Why are we here today? My lovely assistant won't tell me. Hey guys, welcome back to my channel where we're talking tech to tech on cardiac CT. These are 3 things I do to help in setting up for a good quality cardiac CT, and it starts from the ground up in the basics. Number 1, after I lay down the patient, I want to make sure that they're as comfortable as possible. Now, I know in CT we get very busy, and oftentimes this part gets cut out because a lot of times patients are on the table for less than 90 seconds or 2 minutes or 5 minutes, and we're in a hurry and we're constantly rotating patients. But in cardiac CT, we cannot cut these corners. You really want your patient to be as comfortable as possible so that they can be able to take in the appropriate breath holds and to reduce patient motion as much as possible. So I get my patient comfortable, I get a pad under their knees and get them situated. Now, if you are, this is a side note, if you are having problems with your IVs, and let's say you have a nursing staff who's starting your IVs outside of the CT suite, or you are starting IVs outside of the CT suite and they're sitting up in a chair, if you're having a difficult time with the IV, lay them down first. Now, we'll talk more about that in another video on difficult sticks. However, by laying them down and then letting their arm hang down, you'll have a greater chance of getting a good vein. But we'll talk more about that later. The second thing I like to do is after I do get my IV established, once the patient is laying down, of course I will actually do my test injection with a 10 cc syringe. I'll do that with the arm down and just like we would for a normal IV. But then what I want to do is actually bring both arms up above the patient's head, and I'm going to bring both arms up. Now, if the IV is here in her right arm, and let's say we're struggling with that in maybe her shoulders, it's a little too much on her shoulders, use a secondary pillow and elevate that arm up into a better position so it's a little bit easier on the patient's shoulder. If you don't have a pillow, you can use, towels, blankets, whatever you may have. Now, once the patient's arm is in this kind of more of a natural up position, that's when I will test the IV again with a 10 cc syringe. Now, this is my practice for all CTA work. Anytime I'm injecting more than 3 cc's per second, this is how I'm testing that. PE scanning, like I mentioned in another video, I'm usually right around the 5 cc's a second, depending on the scanner, depending on the size patient. So when I test this above their head, now I really know and can feel if there's any resistance for my scan. Now, of course, if you're doing cardiac CT, it is recommended that you do a test saline flush, and I recommend 1 to 1.5 cc's on the saline flush, higher than you're anticipated on using for the contrast. Again, I've talked about in another video, there's viscosity is much higher with contrast than with saline. That means the pressures are going to be higher and the chance of blowing an IV are even higher. So once I get the patient comfortable, step 2, I get their arms into a good position above their head. I want you to do this as much as possible for every CTA patient. And good practice is before you start the IV is asking the patient, do they have one arm that does not go above their head? However, it's also always best to start the IV on the right side than the left side, and we'll get into more of that on another video. So, step 1, get the patient comfortable. Step 2, bring the arms above the head and test out the IV, make sure it works good. Once that's all established, that's when I move to step 3, and that is hooking up the ECG leads. Now, I'm not going to do that here today, but I do the ECG leads with the patient above their head for cardiac CT because when you put the leads on with the arms down, that lead is going to move when the arms come up, and that's when you usually will lose your R tagging, depending upon size of patient, body habitus, and tissue type and that sort of thing. So those are 3 things that if you will take the time to do these things, you will help to have high quality cardiac CT images coming out the other side. So don't skip on these things. These 3 things are very, very important. And unfortunately, I see across the nation as a whole a big lack in these 3 things. So if you're a technologist watching this, do it. All right. Till next time, take care. I do better without a camera, let me tell you. In person. Okay, here we go again. Ready? Not what I want to say. This is more embarrassing when I have somebody here. It's easier by myself. One day, I'm no longer going to have this head setting cord.